Hi, and welcome to my OCR A-level biology revision session with me, Christine. So today's lesson, I want to look at urine testing. So this is looking at the excretory products that can be located in your urine. So we use excretory products for medical diagnosis. So it could be that there is a patient that has a problem and the doctor will ask them to give them a urine sample. Now what they'll then do is they'll take what's known as a clinic stick and they will dip that into the urine for about 30 seconds or 60 seconds, and they will then assess how that colour chart actually coordinates with the colours on the test sites of the stick. Now this is a qualitative process, so we're looking at a colour chart and we are then using that to indicate the presence of certain substances. So you can see quite clearly things like glucose, pH, protein, ketones, and blood cells. So the blood cells, if there are any blood cells indicated in the sample, that could indicate there's a variety of diseases. It could be an infection like a UTI, it could be a form of cancer. So that could be the first signal where more tests need to be done. Now, glucose is one of the key tests when we are looking at the disease diabetes. Now, regardless of whether it's type 1 or type 2 diabetes, the presence of glucose in the urine indicates that there is a problem, because if we think back to our kidneys module, we know that the glucose should be reabsorbed back into the bloodstream. It's reabsorbed back into the bloodstream because it is the respiratory substrate of choice. If we have too much glucose in our blood, then our body will be storing that as glycogen, or if there's too little, our body will be releasing the glucose and therefore the blood sugar levels should rise up again. So if there's an excess of glucose that is within the bloodstream and that is therefore being excreted out and is located in the urine, that is a diagnosis of the potential for someone suffering with diabetes. Now, what we're going to look at today is we're actually going to look at, to start with, the proteins. Now, proteins should only be getting through the basement membrane and the podocytes, that filtering system, if they are small proteins. So things like HCG, which is the human chorionic gonadotrophin, a hormone which indicates pregnancy, and things like insulin. So very small proteins should be able to be moved through during ultrafiltration. However, if there is an indication of a large amount of proteins in the urine, that tends to be a sign of kidney disease. I've done a whole other video on kidney disease, so do check that one out. What I want to focus on right now is how we can actually use urine and test for a pregnancy. But to understand that, we have to take a step back and look at module 4. We have to understand that antigens are specific to the antibody that is going to complement it. And because we understand that, what we have done is we've managed to make what's known as monoclonal antibodies. We take an antigen, we take a molecule, and we inject it into a mouse. Now that results in the mouse producing the correct B cell, and that B cell is going to be removed from the mouse's spleen. So we've got the B cell, which is clonal selection. We're selecting the B cell which has the correct antibody against the antigen, the molecule. Now what we do is we take that B cell and we fuse it together with a tumour cell, and that becomes what's known as a hybridoma. Now remember, a tumour cell is a cell that goes through uncontrolled mitotic division. If it's going to go through uncontrolled mitotic division and we fuse it with this B cell, which has the capacity to make the correct antibody, that hybridoma will now be able to go through mitotic division lots and lots of times and also do protein synthesis, which means we end up with this endless supply of monoclonal antibodies. Those antibodies that have the antigen binding site, which is specific to the antigen, is really important. So how is that useful in a pregnancy test? Well, we can use these monoclonal antibodies in the pregnancy test because if we have these antibodies that are specific to a hormone or a substance, we can then use the fact that they will form a hormone antibody complex to indicate the presence of that hormone. So if you have a negative result, what you will see in the pregnancy test is you will have one window where there is no blue line and one window where there is. This is known as the test site and the control site. So what you've got is that when you dip the pregnancy test into the urine sample, what will happen is those free monoclonal antibodies will bind to any substances that are in the urine sample if they are complementary. So with the pregnancy test, we're looking for HCG, the hormone which is produced to indicate that the woman is pregnant. Now, this is a hormone that the body is producing to maintain the ovary until the placenta is ready for taking over in the growth of the fetus. So it has to be a right concentration to be indicated in the pregnancy test. However, the key thing is that the hormone is being produced. If the hormone is present, it will bind to the monoclonal antibody that is free floating, but also as it makes its way up through the pregnancy test, when it gets to the test site, it will bind if it has a complementary shape. Now, a negative test result means that there is no HCG present. If there's no HCG present, our test site remains open and has not bound with anything. As it makes its way up through the control site, it is complementary to the monoclonal antibody in that control site. So therefore, the free monoclonal antibodies have made their way up through the pregnancy test and they have bound at the control site. And a dye molecule has then been activated, which is why you get the blue line in the control site region. If there is no blue line in the control site, therefore that would indicate a faulty test result. So therefore you would want to test again. Now, if we got a positive result, it's really interesting that the pregnancy test can be any which way they want them to be. So in this case, the pregnancy test is showing you as a cross, or it could just be a line. So it just depends where the monoclonal antibody in the test site has been positioned. So lots of them across in a cross shape or just in a single line. Just depends with regards to the type of test you do. But again, what is happening? Well, you dip your pregnancy test into the urine sample. If there is HCG, the hormone present, the free-floating monoclonal antibodies are going to bind to it. They are then going to move up through the pregnancy test. Now, because there is HCG present, that will now bind to the monoclonal antibody at the test site. So because we have a positive result, we are indicating there is HCG hormone present. Therefore, we are ending up with our dye in two locations because we still have our free monoclonal antibodies that can go to the control site, proving that the test is working, and the monoclonal antibodies which have bound to the HCG because they have formed a hormone antibody complex, they are now bound to the test site too because of their complementary shapes. So therefore that will indicate the person is pregnant because they end up with the dye being activated in two locations. Now, if the pregnancy test actually had a positive result at the test site and no result at the control site, that would indicate again a faulty result. So the use of monoclonal antibodies is really important in us testing the excretory products, the HCG, the small proteins which are released and indicating a medical condition in the sense of a fetus is starting to develop. Now, we can also use the urine sample to identify if someone has, for example, been taking drugs, or in their body there are the metabolites of those drugs, so the breakdown products of those drugs. Now, these drugs and metabolites are excreted in the urine. So what can happen is if someone is in, for example, a sporting activity and there is a suspicion that they have taken some drugs, they could be asked to provide a urine sample. Now, depending on how long ago those drugs were taken, depends on how much they are able to identify those drugs. So ethanol, 6 to 24 hours, you've got amphetamines, cannabis, you've got anabolic steroids. Now, this is the one that they will potentially ask you for in the exam. Now, anabolic steroids mimic testosterone. Testosterone stimulates muscle growth, so it's very fascinating that anabolic steroids can actually be present from 1 to 4 weeks, or depending on the concentration, all the way up to 12 months after it has been taken. So how do they test for it? Well, a sample can be taken and it would then be split into two. The first sample will be tested using monoclonal antibodies. So they use a immunoassay, so they've taken antibodies that are put into a very specific position, and they then run the sample through, and that will indicate whether or not there is a drug present. So that's the first way that they are going to test. If that is positive, what they'll then need to do is they then need to test it to be sure what is the drug that's been taken and also what is the concentration. And that's where gas chromatography and mass spectrometry may be used. Now, don't panic. You're not doing chemistry A-level, although some of you might be. You only need to know the names of these and that they can be used. If they want you to answer any questions, they will give you examples of what they're expecting you to note. So the key thing to note about both gas chromatography and mass spectrometry is that they're going to take a sample. That sample will be vaporized. So what are you doing to that sample? You are turning it into the gaseous state. That gaseous state, and then with a known solvent, is going to pass along a tube. It will then be detected in not only the concentration, but also the presence of the drug. And what you then get is a chromatogram that can be used and analysed to show that presence of a drug. So they want you to know the names of gas chromatography and mass spectrometry. They will not expect you to go into any more detail unless you are doing A-level chemistry. So if you are, you do need to look at more detail how these work. So I hope you've liked this video, and if you have, then please do click on the like button and subscribe to my channel. And if you haven't already done so, do check out my revision platform, www.aiqchat.com.